fracture. In simple words, any kind of break in the uniformity of the bone is called a fracture. Types of fracture. Complete fracture, breaking the entire cross-section of the bone, is known as a complete fracture. Incomplete fracture, a break across only part of the bone. Closed fracture, no break in the skin but bone is broken inside. Open fracture, broken bone protrudes through the skin, in other words, the skin lining is broken. Green stick, one side of a bone is broken and the other side is bent as a green stick. Transverse fracture, break occurs straight across the bone. Shaft. Comminuted fracture, the breaking of a bone into more than 3 fragments, denotes this type of fracture. Clinical manifestation of the fracture. Pain, swelling, tenderness, deformity, loss of functional ability, bleeding, dislocation. Radiography is a reliable tool for diagnosing fractures. Nursing implications. An intercapsular fracture heals with greater difficulty, and there is a greater likelihood that necrosis will occur because the fracture is cut off from the blood supply. Assess the 5 Ps of neurovascular functioning: pain, paresthesia, pulse, pallor, and paralysis. The risk for the development of a fat embolism, a syndrome in which fat globules migrate into the bloodstream and combine with platelets to form emboli, is greatest in the first 36 hours after a fracture. It is more common in clients with multiple fractures, fractures of long bones, and fractures of the pelvis. The initial symptom of a fat embolism is confusion due to hypoxemia. Assess for respiratory distress, restlessness, irritability, fever, and petechiae. If an embolus is suspected, notify the physician stat, draw blood gases, administer O2, and assist with endotracheal intubation. In clients with hip fractures, thromboembolism is the most common complication. Prevention includes passive ROM exercises, the use of elastic stocking, the elevation of the foot of the bed 25 degrees to increase venous return, and low-dose heparin therapy. Orthopedic wounds have a tendency to ooze more than other wounds. A suction drainage device is usually placed, therefore checking the drain is important. Fractures of bone